Hi, Dr. Francis Yu here. Welcome to the MBTI for Physicians series and the sub-series of identifying and discussing misconceptions about the MBTI. So today I want to talk about this misconception. Let's see, let's share the screen here. All right, so this is the question or comment right up here. I'm ENFP, but a couple of decades ago, I tested ESFP. Lately, my introverted side has come out. So the system should address how people can change over time. So this is absolutely fascinating and great because the conception here is that it doesn't, but actually the entire system, the entire system is based on a series of development. So let's take this particular what was it, ENFP, right? That's this person's supposed type. So there are 4 letters, but there's a so much packed into these 4 letters that I can give you an entire workshop on it, and I think I could convey what the meanings are. But let's put it this way: each type has 4 ways of interacting with the world / doing things internally. So every type has ways they prefer to do things. So for an ENFP, their number one thing that they like to do is use their intuition in the outside world. So when they're growing up as a child until about their before their teenage years, they're primarily living their life exercising this function of extroverted intuition. So basically, I mean, other things are being used, sensing, thinking, and feeling, but the number one thing that's happening is extroverted intuition. So in another terms, a child doesn't have a type yet because a person develops a type. You're not um, you are there's innate aspects of it, but the innate type needs to be expressed and developed as one grows up. So of course there's some kinks and things that can go awry here, but that's something for another time. So let's say an ENFP has extroverted intuition as their primary way of living until their teenage years, and then let me share the screen again here. So that's what we call the dominant function here. Extroverted intuition, the short phrase is capital N, small e. Now in their teenage years, they start developing more their auxiliary function, which for an ENFP is introverted feeling. I'm not going to go into all what these functions mean because that will take forever. So in other words, growing up as a child, the ENFP will show more extroversion, and throughout their life they will just have more extroversion qualities. But as a teenager, they will start developing more introversion functions and ability to live an internal life. Now, this happens through young adulthood, and sometime between young adulthood and midlife is when people start developing their tertiary function. So for an ENFP, as a child, it's all about extroversion and intuition. As a teenager, young adult, it's about feeling and introversion that's being used to ultimately support the primary function. So let me backtrack a bit. So so the MBTI, what it pretty much says is that everyone has a dominant type that they profoundly just prefer throughout their entire life. So for an ENFP is extroverted intuition. All the other functions, the secondary, which is auxiliary, the tertiary, and the inferior, will never be as developed as a dominant function. And all of them in the end is to support the dominant function. In other words, a person who prefers extroversion would never become someone who prefers introversion over extroversion. They may develop introverted qualities and preferences somewhat as time goes on, but it will never overcome the primary preference of extrovert intuition. So going back to our example here. So let's say this person is ENFP. Their entire life, they're going to be extroverted intuition. That's their dominant function for their entire life at their preference. As they grow, they're going to develop introverted feeling, thinking, although people argue whether it's extroverted or introverted, let's just say thinking for now. And then something that they're most uncomfortable with will be introverted sensing, which is developed way later on. But in the end, it is all for the sake of extroverted intuition. So going back to the comment up here, right? I'm ENFP, but I tested as an ESFP. So in other words, okay, they may have started. Well, actually, we don't know. Maybe they were ENFP or ESFP. We just don't know because again, the test doesn't tell you what your type is. So I'm just going to throw that out for now. Let's just say this person's ENFP, and this person's introverted side has come out. Exactly. That's normal. That's how people develop, function, and balance themselves out. Being completely extroverted or completely introverted is, I would say, pathological. It is unhealthy. It is unbalanced. There is someone maybe not quite. So people will never be completely 50%. They may come close, but there's always a preference. So to answer this long story short, the system does address how people can change over time. Caveat or clarification, your type doesn't change. How you appear to yourself and others changes because you're developing into your type. You're obtaining the skills and experience to observe and be acquainted with your less preferred functions. So ENFP should appear or will accept their introvertedness more as time goes on. That is the balance aspect of the MBTI. That is a built-in system to the MBTI. Now, this can go awry. I would say if there's traumatic experiences or medications involved, or there's the household didn't let's say if this person grew up in a household where they were forced to do introverted things, it may distort the way they develop. But in the end, it is a balanced preferred pathway to balancing out your functions. So that the misconception here is that the MBTI doesn't address how people can change over time, but in fact it does. And in fact, it does it a lot. That's a big, gigantic part of the MBTI is showing you, or each type, how they can develop and ways they can develop and ways in which they may not be developing and the obstacles they need to get through. All right, so that still may be a little bit confusing, but I think that answered that question or comment. So check out my other videos because I think if you watch all of them, you kind of get the whole picture together. But this sub-series is to answer these misconceptions. So thank you for listening. Subscribe to get more about the Myers-Briggs Type Indicator for physicians, Enneagram, and other modalities for self-awareness, personal development, and physician wellness. And subscribe and check out the rest of the videos in this series. Bye-bye.